moving on, just to kind of hit on a few things that affect communication. Spirituality is often something that can frame people's communication. And nurses really have to be careful to document spiritual care, because this is something we do kind of instinctively sometimes, but we don't really think of it as a specific thing that we're doing, but yet we do respect all persons and their beliefs, and that's our goal. And using spiritual care is a good example of communication leadership. In other words, taking some of those things that are going around in the actual communication environment between two people and looking at how can I do a better job in that one particular aspect by drawing attention to it, making it a central focus of my communication strategy. And so when you think about communication leadership, it's not just how do leaders communicate, but how are you being a leader and really doing a great job in your communication strategies. There's also a lot of literature out there about a hostile work environment. For many years we've heard the term eating our young in nursing. That actually seems to be somewhat improved from some of the literature I've reviewed lately. There's more and more incivility training that's been done both at the physician level, for all nurses working together, and many hospitals have really put in policies that say that they have zero tolerance for any type of bullying while people are in the work environment. And that can also deal with social media and other connections of people from the work environment out into the social arena. So be careful, that you understand what those policies are. If you have an environment that really adheres to zero tolerance for this kind of thing, you have to be part of the solution by reporting when instances of incivility or bullying take place, so that actions can be taken to really remedy those situations and make sure that the environment is safe, both physically safe and emotionally a good place to work. Nursing managers have a duty to really keep a pulse on their work environment safety and civility levels. So, they may be asking you things as a new employee that's getting hired who's not been part of the normal environment. What are your perspectives? And it's a great opportunity for them to get some honest, non-biased information. So if they're asking, that there's somebody who cares and is concerned about that, and is a great opportunity for you to share your ideas and thoughts. And they welcome that, and that's a good sign that they are really taking this responsibility seriously. So nonviolent communication, people can make an observation, they can express a feeling, they can express a need, and then they can make a request without demanding. And so you'll see some information in your textbook that you'll see it says NVC, and it's talking about nonviolent communication. And there's specific strategies like this in terms of how do you go about having communication and keeping that communication with somebody, not turning into a conflict. So instead of, ramming something down their throat or accusing somebody of something, you may make an observation like, I've been watching you go in and out of rooms, and I've been doing the same thing too, and I've been noticing that sometimes we don't always use a hand sanitizer like we're supposed to. And then that's the observation. And then you may express a feeling like, I think this is really a hard thing for me to remember to do. Sometimes I'm forgetful, and sometimes I'm just hurried and anxiety ridden, and But I really do feel like that this is an important thing we need to be doing better at. And I think we really need to kind of focus on this in terms of expressing a need. And then making a request without demanding could be done in a joint way or in a single way. You could just say something like, would it be okay if I help remind you and you help remind me? And that way we won't have an issue. Maybe that can help us both do better. So that's a very nonviolent way to bring up someone's lack of hand washing with hand sanitizer, for an example. But lots of other things, if you use this kind of model about how you think about it, you're likely to have better results in terms of the person being more willing and more open to listen. Tuckman has a wonderful theory that talks about how groups actually form. And you all are forming groups, so you're going to go through processes, and I want you guys, when you're doing your reflections about group activities, to be thinking about, like, what stage were we at when this was happening? And Tuckman says that you come together as a new group, and first thing you do is you're forming, and not just like physically meeting, but you're forming. You're forming impressions of the people in the group. You're trying to get to know the talents. Some of that comes along with people having done a little bit of homework in terms of letting the group know what they've previously done, what's their background, what can they be useful in the group. Sometimes it's like we're forming, getting an idea of like what is our task in this group to do, and how do you guys think we need to go about this. Some of those kind of things happen in the forming stage. In the storming stage is usually one where the people in the group are like really starting to throw out different ideas. Sometimes there's a lot of different belief. One person's got some great ideas, another person's got some great ideas. We have a limited amount of time to explore all those. We want to make sure everybody's sort of heard, but not every idea is valuable. Not every idea is functionally going to work in the time period that we have. And so the group goes through this storming stage of kind of like coming to grips of how do you pull individual ideas into a group goals and how we're going to go from here forward with what we're working on. And at the point when they start to have some synergy in terms of, okay, now we've taken all this information together and now we're going to start norming it and bringing it together and evolving all that into an action plan that kind of everybody can agree upon. That's the norming phase. And then lastly is when the group actually starts taking actions, doing action plans and performing, and at the same time evaluating that performance. So that's just a good way of thinking about how you bring together your groups. This is just some information about team steps. Many of you may be trained in team steps when you go to work at certain agencies. Sometimes it's part of the nursing or even the general hospital orientation process. But they will take specific issues. One of these, again, that we've already mentioned, poor communication, number one cause of preventable medical errors. And this is a team-focused thing that was been put in place and has worked very, very well and been researched heavily and found that can have major improvements in safety in your organization if you follow things in a organized way, all together on the same page about how you handle things. And so I can't teach team steps. It's like a 2-day course. You won't get all of that from your textbook, but as long as you kind of get the gist of what some of those principles are about, and know that you may hear about this soon in the future, good to know. And these are just kind of what the patient care team and kind of in a pictorial form in terms of that. You've already learned a lot about SBAR. we can learn what SBAR stands for, but actually, when you guys went through Adult Health 2 clinical SIMS, trying to figure out how to stick to that kind of format in your head all the time sometimes can be difficult to remember, did I really describe the background? Did I really go do an assessment before I called the doctor? Did I do the right assessment before I called to even ask for a recommendation, or did I just call with the problem and not follow through on the other steps? So you got to try to do that as much as you possibly can, because it's really, really beneficial for patient care to use that format. Many of you will go to work on a unit that has a huddle, and there actually is an acronym for huddle. Healthcare utilizing deliberate discussion linking events. And so it's not just, well, we have a huddle because it means we put our heads together and talk about stuff. It's meant to be a real deliberate, often the format of the huddle and the items that are covered are predetermined, like what safety things are we going to report on, what other issues are going on our unit that really tie directly or link directly to kind of safety events, and that those are always on the bullets for the team huddle report, so that everything's linked together, everything's very deliberate. It's not, oh, well, y'all had any problems, where it's very organized. And it's based on this idea that organization in always doing that is going to keep everybody thinking about those key elements all the time throughout their day. There's just another pictorial of SBAR. We talked about this 8 Cotter's change when we did the change one, so I won't reiterate those elements, but those are the 8 stages of that. Current issues and trends, probably mostly you see a lot of things in healthcare today where we are having more and more diversity, and really having more acceptance of different viewpoints, different cultures, different ideas, different ways of handling situations than in his past history. So being open and open-minded in a team, and having good communication that even draws out some of these particular things. Like if you're going to be in a group and there's you're there to represent a different kind of population, then you clearly would want to get somebody there that's the expert related to that. So sometimes in your team focus, I would encourage you to think when you're in your groups, do we have somebody in here that's sort of an expert on that? And if not, where do we go to get the expertise information so we get the best answer for these activities that we're working on? And that's true when you get in the workplace. If you're in a team and you're working on something and you don't really have that level of expertise, you need to find out where to get that, and you'll have much better end results of your thing. This is just a nice little acronym that goes along a little bit with the nonviolent communication model. There's also something called the VERA framework, where you validate someone's statements, that you understand it, that you and make sure that what you heard them say is actually what they meant. You ask if there is a specific emotion or feeling, what are you feeling about this? Reassurance is provided, and then you can move on to taking an action based on what you're communicating. Here are some other communication issues. Obviously, we know about HIPAA. Emergencies, different ways of handling problems, whether that's strategic planning to prevent problems from occurring, or other tools that you can do to investigate where breakdowns occurred, and we'll look at some of that related to quality management later on. And then how do you do electronic communication versus written communication, and best practices around those need to be considered. So anyway, that's the end of these. We can also talk about some of this later, but you'll use some of this in some of your initial team activities. So keep this to go back to.